now. Applying hand hygiene. Hi, my name is Neil. I'll be your nurse for today, and I'm be the one who's gonna administer your heparin medication through subcutaneous injection. So first off, I'm gonna provide privacy for the patient. Raise the bed on a working height position, side rail down, and then before I verify my patient, I'm gonna apply hand hygiene again. So can I get your wrist, please? Yes, you may. Okay. Can I ask for your name? Yeah, my name is Mr. Bob Smith, and what's your date of birth? April 19, 1940. Okay, Mr. Smith, are you allergic to anything such as medication, food, environment, or animals? If so, what are your reactions? I'm allergic to bee stings and shrimps, and I tend to have itchy skin and redness. Okay, now that I have asked for his allergies, I'll be moving on to my pre-assessment, which includes vital signs, pain assessment, and skin assessment. So for his vital signs, we'll be doing his pulse rate, respiration, blood pressure, temperature, and L2 sat. And let's say for his pulse, he got 64 beats per minute. It's within a normal range of 60 to 100 beats per minute. And for his respiration, he got 13 beats per minute, which is within normal range of 12 to 20 beats per minute. And also for his temperature, it is 37.5, which is within normal range of 35.5 to 38 degrees Celsius. And as for his O2 sat, it is in 98%, and it is within normal range of 95 to 100%. And as for pain, we are assessing for OPQ or STV. And also for his blood pressure, I'm checking for any drop on the or decrease on his blood pressure. Now, and his blood pressure is around 115 to 80, and it's within normal range of 120 of systole and 80 for diastole. Now I'll be moving on to my skin assessment, so I'm gonna apply hand hygiene again, and I'm going to um, take off the blanket, roll it down, and then raise his gown, and then um, check. Inspect. I'll be inspecting his skin, his upper extremities and lower extremities for any bruising, masses, or edema, itchiness or redness on the skin or irritation. And I'm also checking the site that I'll be performing this on too. Now that that I have checked and there is no signs of any of that, I'll be putting everything back, and then I'll be telling Mr. Smith that I'll be right back to get everything that I need. If you need any help, the call bell is here on to your right side. Just press that one, and any nurse will provide come for your help. And I'm gonna provide the privacy on for Mr. Smith. I'm gonna lower the bed, nose position, and side roll up to prevent fall. And I'm gonna leave the room. As I leave the room, I'm gonna apply hand hygiene. Now I am now in my med cart, and I'm gonna apply hand hygiene again. So um, first off we're gonna sign. So I'm just trying to look for my pen here. Okay, so I'm gonna sign my first name, my last name, my first name, and signature, and initial. Okay, now I have my MAR and my doctor's order. So we're just gonna verify our patient. So we got Mr. Bob Square, Mr. Bob Square, Mr. Bob Square, patient ID 12345, patient ID 12345, date of birth April 19, 1940, April 19, 1940, Dr. Trajanki, allergic to bee stings and shrimps, bee stings and shrimps. Now that I have verified my patient, I'll be verifying my medication. So we have here is on our doctor's order, we have a MAR. We have in our doctor's order we have a heparin, 10,000 units, which is 1 ml, 10,000 units, 1 ml, subcutaneous every 12 hours, every 12 hours. Okay, I'll be pulling this away. Now, I will then do my first check. I will pull the heparin out of the med cart. So here we have the heparin, and we're pretty much comparing it with the more here. So, and we're looking, we got heparin here, and then heparin. Here it says 50,000 units, 5 ml, and underneath said 10,000 units for 1 ml. And here it's and the doctor's order says, oh sorry, the MAR says 10,000 units on 1 ml, and then subcutaneous every 12 hours, every 12 hours. Okay, now that I have verified my medication, I will be doing my second check, and my second check will be the same thing. So first off, I'm gonna verify my patient. Mr. Bob Smith, patient ID 12345, patient ID 12345. Date of birth April 19, 1940, April 19, 1940. Dr. Troy Jenke, Dr. Troy Jenke. Okay, and heparin, um, 50,000 units, 5 millimeters, and 10,000 units for 1 millimeter. Here it says 10,000 units per 1 millimeter. Subcutaneous every 12 hours and every 12 hours. And this is, I forgot to mention on that this heparin will be administered at the 15th of June 2020. And I'm also checking the time if it has been administered yet. So far it's not, so this is being administered to Mr. Bob Smith at June 15 at 2020 at 8 o'clock in the morning. So same thing with my second check. Oh sorry, that was my second check. And then before I move on to my third check, I'll be preparing everything. So I'm gonna get my tray here, so I'm gonna apply hand hygiene and get everything that I need. So we have here is a 1 millimeter syringe, blunt fill needle, 25 gauge, and alcohol swab, and then we have a vial here. So first off, I'm gonna apply hand hygiene, and then I'm gonna connect this two, and I'm gonna apply alcohol swab on my vial, make sure it's clean, and I'm gonna take this off using this method, and I'm gonna put 1 millimeters of air. I'm making sure I'm not touching the plungers so I don't contaminate it, and I'm gonna put it here. Put this upside down. Okay, and I'm checking for any air bubbles, and if there is air bubbles, I have to flick it up. Okay, then I'm gonna scoop, and if there's excess of fluid, I'm just gonna try to pull it on the 1 ml or put the rest on the sharps container. Okay, so we won't be needing this blunt fill needle anymore, so we could take it off, put it in the sharps container, and we'll be switching it to a 25 or 27 gauge needle. Okay. I also forgot to mention that during my before my first check, I forgot to check my PTT sheet. So first off, we're gonna check our PPT sheet, and it says here 27 seconds, so it is within normal range of 22 to 37 seconds. Okay, so now that I've got everything that I need before I go to my patient room, I'll be doing a third check. So before I do my third check, I'm gonna label my syringe first with my name, concentration, and the name of the drug. So we got heparin, 10,000 units, 1 ml, my name, the time, and date of being administered. Okay. Now that I have that, I'll be doing my third check between my label, my MAR, and my drug. So first off, we got heparin. Oh, first off, we're gonna identify a patient. So patient ID 12345, Mr. Bob Square. Date of birth April 19, 1940. Dr. Trajanki. And allergic to bee stings and shrimps. Okay, now moving on to the medication. So we got here is heparin, 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 10,000 units on 1 ml. It's at 50,000 units for 5 ml and 1,000 units. 10,000 units in 1 ml. And here we got, we're making sure that we got 10,000 units here, 1 ml of heparin, and we do. And subcutaneous every 12 hours, every 12 hours, every 12 hours. Okay, and the time that is being administered. Yeah. So now we're done our third check. I'm also signing an anti-glycolation sheet. So first off, the date, the time is being administered, and we're giving and the results were 27 seconds PTT, and we're giving heparin 10,000 units 1 ml on the left lower abdominal, and the site is left lower abdominal. Okay, and then we're also having our second nurse to sign this coagulation sheet. Okay, now I can bring everything in my patient room. So first I'm gonna apply hand hygiene, and this goes to the sharps container. So we have here is our tray and our syringe with a needle and elbow swab. So knock knock, applying hand hygiene. Hi, I'm back. So I'm just gonna raise the bed on my working height position and then side roll down. And then before I do my two identifiers, I'm gonna apply hand hygiene, and I'm gonna get his name and date of birth again. So can I have your wrist, please? Okay, good. And can I ask for your name? Yes, my name is Mr. Bob Square. And as I'm doing this, I'm also checking my mark. Mr. Bob Square. Yep, Mr. Bob Square. And what's your date of birth? April 19, 1940. Okay. April 19, 1940. Dr. Trajanki. Dr. Trajanki, patient ID 12345. Patient ID 12345. Allergic to beeswax and shrimps. And allergic to beeswax and shrimps. Okay, good. Now I'll be doing a one last check with my MAR and my syringe. So heparin, oh, heparin, 10,000 units. Checking again. Make sure I have 10,000 units here. 1,000 units, and then 1,000 units. Subcutaneous every 12 hours. Okay. Good. So now, before I even administer this to Mr. Smith, I'll be telling Mr. Smith that I'll be teaching him about it and tell him what does heparin do. So, before I administer this to you, heparin is a medication that pretty much helps with your blood clotting. It's a blood thinner, and also you may feel a little bit stingy when I inject this to you, and also you may feel fever, and um, that would be the adverse effect of it. And please don't rub the site, or if there is unusual bleeding to your gums or nose, just let us know. And also um, and use soft toothbrush for that. And also don't play around with your site. It may cause irritation or bleeding. Okay, now that I have told him about that, now that I have told him about my patient teaching, I'm gonna proceed to do my administer the med. So I'm gonna apply hand hygiene, apply gloves. So let's pretend this is his skin. Okay, so I'm gonna do rainbow effect. Okay, so I'm gonna press this like a dart. I'm going to do around 20 to 90 degrees angle depending on how deep there's subcutaneous skin is. So since his a bit fat, we'll be doing a higher degree. So I'm gonna do a 55-degree angle. I'm gonna hold, I'm gonna pinch, and then I'm gonna inject slowly. And then I'm going to put on the medication very slowly, and I'm holding it. I'm holding the pinch, holding it in there slowly. Take this off, and I'm holding it for. Oh, sorry, I forgot. I'm holding this for 10 to 15 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and then take it off. And then this will go to the sharps container, and I'm gonna apply. Let's pretend this is a gauge, and I'm gonna apply gauge in there, and then um, I'll be putting everything on the sharps container. So I'm going to tell Mr. Smith that I'll be right back to monitor his lab results and I'm going to do some pre-assessment, such as his vital signs, and check how he's feeling. So, how are you feeling, Mr. Smith? Feeling good? Are you feeling alright? Okay, that's good. So, and I forgot to mention that I forgot to ask him the right to refuse. So I'm just gonna pretend that I have asked that. So are you okay with all this? Yes, I'm okay with all this. Okay. So now, so I'm gonna tell Mr. Smith that I'll be coming back to check on him. So call bell. He's here in his right side, and if you need any help, just or have questions, just press that one, and we'll be there for you. And I'm gonna lower the side rail, and then I'm gonna lower the bed and then side rail up to prevent fall, and then apply hand hygiene, and then I'm going out to sign my MAR, and I'm gonna proceed to my documentation.